NLN Nursing Entrance Exam Study Guide. Question 1. Which increase is shown from Monday 15 to Wednesday 22 in a simple practice chart in this patient teaching item? Option A, 37. Option B, 5. Option C, 22. Option D, 7. The correct answer is option. The increase is the final value minus the starting value, 2215 equals 7. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 2. During a quick next review of a dosage label item, which word is closest in meaning to abundant in a classroom review sentence? Option A, silent. Option B, fragile. Option C, plentiful. Option D is scarce. The correct answer is option. Abundant means plentiful, so that choice matches the meaning in context. Silent relates to sound, not amount. Fragile means easily broken, not plentiful, and scarce means limited, not plentiful. Question 3. After checking the choices in an infection control item, which answer identifies the substance dissolved in a solution? Option A, solute. Option B, precipitate. Option C, catalyst. Option D, solvent. The correct answer is option. The solute is the material being dissolved. Precipitate is a solid that forms in solution, catalyst speeds a reaction, and solvent does the dissolving. Question 4. If a fall prevention stem gives one clear clue, which answer best explains the author's point? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, hand hygiene cannot affect infection. Option B, a training may have improved compliance with hygiene practices. Option C, the refresher removed all risk permanently. Option D, a training increased infection rates. The correct answer is option. The sequence suggests training supported better hygiene behavior. Hand hygiene cannot affect infection, is not supported by the passage. The refresher removed all risk permanently, is not supported by the passage, and training increased infection rates, is not supported by the passage. Question 5. When time is limited on a nutrition note question, which increase is shown from Monday 19 to Wednesday 29 in a simple practice chart? Option A, 7. Option B, 10. Option C, 48. Option D, 29. The correct answer is option. The increase is the final value minus the starting value, 2919 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 6. Given the information in an oxygen exchange item, which second quantity matches a 2:6 ratio when the first quantity is 4? Option A, 14. Option B, 12. Option C, 16. Option D, 4. The correct answer is option. The first part grew from 2 to 4, so the scale factor is 2. Multiplying the second part, 6 times 2, gives 12. The other values use the total, the first quantity, or an extra scale step instead. Question 7. Suppose a similar study schedule item appears on test day. Which word is closest in meaning to anticipate in a classroom review sentence? Option A, repair. Option B, expect. Option C, erase. Option D, delay. The correct answer is option. Anticipate means expect, so that choice matches the meaning in context. Repair means fix, not expect. Erase means remove, not expect. And delay means postpone, not expect. Question 8. While working through a timed lab safety set, which answer identifies the transfer of heat through direct contact? Option A, evaporation. Option B, radiation. Option C, conduction. Option D, convection. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Evaporation is liquid changing to gas, radiation transfers energy by waves, and convection moves heat through fluid circulation. Question 9. Before choosing an answer in a blood flow item, which answer best explains the author's point? A clinic sends appointment reminders, and missed visits decline. Option A, reminders can help patients remember appointments. Option B, appointments no longer need scheduling. Option C, reminders caused more missed visits. Option D, patients cannot benefit from reminders. The correct answer is option. The decline in missed visits supports the role of reminders. Appointments no longer need scheduling is not supported by the passage. Reminders caused more missed visits is not supported by the passage, and patients cannot benefit from reminders is not supported by the passage. Question 10. A student sees this kidney function idea on a next review. Which answer identifies the transfer of heat through direct contact? Option A, evaporation. Option B, convection. Option C, radiation. Option D, conduction. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Evaporation is liquid changing to gas, convection moves heat through fluid circulation, and radiation transfers energy by waves. Question 11. One immune response practice problem tests this skill. Which weight in pounds is closest to 75 kilograms using 1 kilogram equals 2.2 pounds? Option A, 77.2 pounds. Option B, 165 pounds. Option C, 1,650 pounds. Option D, 34.09 pounds. The correct answer is option. Multiply kilograms by 2.2, so 75 times 2.2 equals 165 pounds. The other choices divide instead of multiply, add the conversion factor, or move the decimal one place too far. Question 12. Several choices look tempting in a medication math item. Which word is closest in meaning to cautious in a classroom review sentence? Option A, frozen. Option B, reckless. Option C, cheerful. Option D, careful. The correct answer is option. Cautious means careful, so that choice matches the meaning in context. Frozen means very cold, not careful. Reckless means careless, not careful. And cheerful means happy, not careful. Question 13. For this reading passage nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, estimation. Option B, bias. Option C, classification. Option D, replication. The correct answer is option. Replication checks whether results are reliable across repeated trials. Estimation is an approximate calculation, bias is a systematic error, and classification is grouping items. Question 14. In a short grammar check practice STEM, which answer best explains the author's point? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, timed practice can build exam familiarity. Option B, comfort never changes with practice. Option C, the exam has no time pressure. Option D, timed sets remove all content gaps. The correct answer is option. The passage connects timed practice with increased comfort. Comfort never changes with practice is not supported by the passage. The exam has no time pressure is not supported by the passage, and timed sets remove all content gaps is not supported by the passage. Question 15. Among the choices in a word knowledge item, which critical thinking response best fits this situation? A patient says, I feel better, so I stopped the medication early, in a health literacy passage. Option A. The patient fully understood the instructions. Option B, teaching is unrelated to medication use. Option C, medication should always be stopped early. Option D, the statement shows a need for clearer teaching about completing treatment. The correct answer is option. Stopping early can be unsafe depending on the medication and condition, so teaching is needed. The patient fully understood the instructions does not follow from the situation. Teaching is unrelated to medication use does not follow from the situation, and medication should always be stopped early does not follow from the situation. Question 16. Using the facts in a data table question, which number is 12% of 80? Option A, 92. Option B, 96. Option C, 9.6. Option D, 68. The correct answer is option. 12% means 12/100, so 80 times 12/100 equals 9.6. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 17. Based on the clue in an algebra review item, which word is closest in meaning to consistent in a classroom review sentence? Option A, changing. Option B, fragile. Option C, steady. Option D, distant. The correct answer is option. Consistent means steady, so that choice matches the meaning in context. Changing means varying, not steady. Fragile means easily broken, not steady. And distant means far away, not steady. Question 18. Consider this high-yield heart rhythm concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, a trachea. Option B, artery. Option C, capillary. Option D, a vein. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Trachea carries air, artery moves blood away from the heart, and vein returns blood to the heart. Question 19. Near the end of a lung function review session, which choice most accurately summarizes the passage? A patient education sheet used short sentences, headings, and pictures. Option A, clear formatting helps readers understand health information. Option B, long paragraphs are best for patient teaching. Option C, pictures make written instructions unnecessary. Option D, headings reduce the value of information. The correct answer is option. The sheet is designed to improve readability and comprehension. Long paragraphs are best for patient teaching is not supported by the passage. Pictures make written instructions unnecessary is not supported by the passage, and headings reduce the value of information is not supported by the passage. Question 20. Across similar digestive process nursing entrance questions, which increase is shown from Monday 18 to Wednesday 26 in a simple practice chart? Option A, 26. Option B, 8. Option C, 5. Option D, 44. The correct answer is option. The increase is the final value minus the starting value, 2618 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 21. Since only one choice fits the homeostasis clue, which probability describes drawing a red card from a set with 7 red and 6 blue cards? Option A, 7/13. Option B, 7/6. Option C, 6/13. Option D, 13/7. The correct answer is option. Probability is favorable outcomes divided by total outcomes, so the result is 7/13, simplified to 7/13. The other choices use blue cards, compare red to blue only, or invert the fraction. Question 22. From the information in a scientific method item, which word is closest in meaning to detect in a classroom review sentence? Option A, invent. Option B, ignore. Option C, discover. Option D, scatter. The correct answer is option. Detect means discover, so that choice matches the meaning in context. Invent means create, not discover. Ignore means overlook, not discover. And scatter means spread out, not discover. Question 23. At a testing desk during a control group review, which answer identifies the organ that produces bile? Option A, gallbladder. Option B, kidney. Option C, liver. Option D, pancreas. The correct answer is option. The liver produces bile, which helps digest fats. Gallbladder stores bile, kidney filters blood, and pancreas secretes enzymes and hormones. Question 24. Inside a sample size science or skills item, which choice most accurately summarizes the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A, volunteer programs grow without communication. Option B, former patients stopped the program. Option C, personal stories can motivate people to participate. Option D, orientation should never include stories. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Volunteer programs grow without communication is not supported by the passage. Former patients stopped the program is not supported by the passage, and orientation should never include stories is not supported by the passage. Question 25. Through careful reading of an enzyme activity stem, which answer identifies the group that does not receive the experimental treatment? Option A, a conclusion. Option B, sample. Option C, a control group. Option D, experimental group. The correct answer is option. A control group provides a comparison for the treatment group. Conclusion is the final interpretation, sample is the participants or items studied, and experimental group receives the treatment.